This video is going to set the whole record straight with regards to Fertilo procedure being now the new boy on the block with regards to our answers as reproductive medicine specialists to solve our fertility patients' problems. Now, what it doesn't address is what is it trying to achieve. So in order for us to understand the concept, one needs to know that when we just take eggs out of the ovary, the eggs are in an immature phase. And one of the reasons why we do stimulate patients for IVF is to get as many eggs as we can. And then we finally give a maturation injection, which then gets the eggs out of the resting phase into the mature phase. Now, what's important to understand is only mature eggs can really fertilize. Immature eggs cannot fertilize. Now, we have been talking about in vitro maturation, in other words, maturing eggs in the laboratory, before we then go on and do the IVF procedure in the lab and make embryos. Now, what's important is this Fertilo procedure is all it is usually using stem cells within the media to try and help immature eggs become mature eggs. Now, in order to get immature eggs out of ovaries, all your eggs in your ovaries are in their resting phase, and only one egg once a month will come out of the resting phase, go into the mature phase. You will release that egg, and that egg will then be able to be fertilized. So with this process, you still have to undergo an egg retrieval. Now, one of the things when we're trying to get immature eggs out of you, it is often very difficult to get a large number of eggs. And with a smaller number of eggs, obviously you're in with a smaller chance of being successful. So using the procedure can save you the need to have drugs to stimulate you. You will still need to have an egg retrieval, and the eggs in the laboratory will be put into this media in the hope that the media will then get these immature eggs to become mature eggs. And if they do, then we can fertilize the mature eggs in the lab. So you will still have the laboratory fee, and you will still then need to undergo an embryo transfer. So at the end of the day, this process, the only thing that it's going to do for us is in certain patients who don't stimulate well or who keep giving us immature eggs, this may be of value. But interestingly, if you go back and you look in Google and you go and look up the history of IVM or in vitro maturation of eggs, we have been bashing our heads up against a brick wall for many years. And please, what I appeal to the people out there is not to see this as the new boy on the block that's going to be the savior for us for in vitro fertilization to help patients who have difficulty falling pregnant. The majority of patients will still have to undergo stimulation, and again, to improve the outcome, it is a numbers game. And obviously, the more eggs you get, the more embryos you'll get, and the more embryos you get, the more likelihood there'll be normal embryos that will then get you to achieve a viable ongoing take-home baby. So please remember, don't see these things because they do appear, and then you see them in economic articles, you see them in Facebook, you see it all over the place, and it's promulgated as being the best new thing since Pa fell off the bus, which it isn't. So watch this space. Yes, we've been talking for more than almost 25 years about in vitro maturation, and we are still using stimulation, and we are still getting eggs out and getting patients pregnant. And yes, there are certain aspects to stimulation, and today we avoid ovarian hyperstimulation syndrome. There is no risk of that happening, and majority of patients after an egg retrieval are comfortable. And irrespective with this technology, you are still going to need an egg retrieval, and you are still going to need IVF, you are still going to need to fertilize these eggs in the laboratory. So all it does is save you the need to have stimulation. Thank you.